Good morning everyone. I am Dr. Lalit Pursnani, Professor, Department of Nephrology, RML Hospital. In this session today, we will be discussing chronic kidney disease and its association with pedal edema. We will also be discussing the causes, symptoms and treatment of pedal edema. First, let's see what is chronic kidney disease. Chronic kidney disease is defined as continuous and progressive damage or loss of nephrons which lead to loss of renal function. Kidney is a vital organ in the body. It performs various functions in the body like maintenance of electrolyte and mineral balance, acid-base balance, and it also helps in excretion of water-soluble waste, as well it also helps in production of some hormones like vitamin D and erythropoietin. Once kidney function starts going down, kidney is not able to execute some of these functions. Let's see what is chronic kidney disease stages. There is stage 1, which is defined as eGFR more than 90 ml per minute. CKD stage 2 is defined as eGFR of 60 to 89 ml per minute. CKD stage 3, which is also called mild to moderate renal dysfunction, is defined as GFR of 30 to 59 ml per minute. And CKD stage 4 is defined as eGFR of 15 to 29 ml per minute, and CKD stage 5, or when we say the patient needs dialysis or transplant, is CKD 5, which is eGFR less than 15 ml per minute. Kidneys are able to compensate for this loss of function, and so the symptoms appear quite late when the kidney disease damage is quite advanced. Some of the symptoms of advanced chronic kidney disease are nausea and vomiting, pedal edema, sleep disturbances, lack of cognition, loss of cognition, lack of appetite, weight loss, and some other symptoms. First, now since we have discussed the symptoms of chronic kidney disease, we will specifically focus on pedal edema. So what is pedal edema? Pedal edema is actually swelling of feet or ankles, and it has various mechanisms. They can work in unison or separately. If we discuss the mechanism of pedal edema in chronic kidney disease, there are two main mechanisms of pedal edema in chronic kidney. Number one is loss of protein in urine, and the second one is impaired kidney function. Nephrotic syndrome is a condition where there is loss of protein in the urine. Once there is loss of protein in the urine, the kidneys feel that there is loss of blood volume, and so they start retaining salt and water, which results in edema of the tissues. The symptoms of pedal edema are stretched or shiny skin, puffiness or swelling of tissues below the skin, or there is retainment of, if you press the skin, there is retain of the dimple on slight pressure of skin. Now we will be discussing the treatment part. The major treatment is we treat the underlying cause of the pedal edema. Other treatment could be one should restrict its salt intake. There are drugs which are called diuretics, which enable the kidneys to excrete more water and salt and reduce the pedal edema. One could use compression stockings, and the fourth treatment could be sometimes elevation of legs for at least 5 to 10 minutes above the heart level 3 or 4 times per day. Last but not least is once patients who are at risk of chronic kidney disease such as diabetes or hypertensive should get regularly tested for their renal functions, and once they are known, they should restrict their salt intake and water intake for the management of pedal edema. Thank you.